Now we're moving on, and we're talking about the next stuff we should be discussing here, and this one is clinical presentation of acute lung injury. Clinical presentation of acute lung injury. So this is more of like the signs and symptoms, what the patient will complain about, what you also notice. Alright, so for acute lung injury, mostly is respiratory issues. So sudden onset of dyspnea. So the patient is having shortness of breath, having tachypnea, so rapid breathing. Okay, then hypoxemia. Okay, so breathing is not nice, so the circulation of oxygen in the body is also not what nice. Then physical findings, you see that the patient is straining to breathe, so they are using accessory muscles. You hear crackles and rails. That's basically when you try to listen to how they are breathing. Then because oxygen is not reaching tissues very well, the body is becoming bluish, especially for children. Okay, so systemic manifestations, you see that maybe they are having other disease conditions like sepsis, trauma, pneumonia, okay, and the rest of it. So if you do imagings, you see infiltrates. If you do arterial blood gas, you see that what oxygen levels is low. Okay, then you also see diffuse alveolar damage pattern. Okay, so that's what we got.